Welcome back to Optometry Unleashed. I'm your host, Dr. Trevor Miranda, and today we're turning up the volume on an untapped opportunity, merging the worlds of optometry and audiology under one roof. So listen closely. We're about to uncover a powerful partnership that will amplify your practice and fine-tune your patient care. Joining me today is someone who truly knows the business inside and out. He's been at my side both personally and professionally, and if anyone could talk about the synergy between hearing and vision, it's him, my brother, Dr. Terence Miranda. Terence started out as a geological engineer in the oil and gas sector, but decided to make a bold career shift to follow his passion for helping people. After earning his doctorate of audiology from Salus University, Terence quickly made his mark in the field. Among his accomplishments are pioneering a totally implantable hearing aid and developing the first diagnostic protocols for the BC Early Hearing Program. Terence then founded his own practice of Residence Hearing Clinic, which now has 5 locations, all strategically placed around optometry practices. I'm incredibly proud of everything he's achieved, and I'm excited to have him here today. So without further ado, please welcome my brother, from the same mother, Dr. Terence Miranda.
Hi, Trev.
Hey, it's so glad to have you here on Optometry Unleashed. You know, I think there's a lot of my colleagues and a lot of our listeners that don't really understand, what audiology is and what are some of the amazing things you do there. So we're excited to explore that. What was your inspiration, Ter, getting into audiology and such? Why audiology?
Well, just a little bit more. You know a little bit about my background, but just to describe it to your listeners, my background is in engineering, and I worked as a reservoir engineer for a major oil company for a couple of years. And it wasn't so much what attracted me to audiology, but what I found during my experience that I you know, kind of thought there was some room for, let's call it room for improvement in my life in terms of what I wanted to do. So I had a list of 10 things that I didn't like. I flipped those around to 10 things that I wanted from a career. And I was actually at a conference, at one of your conferences, at an optometry conference, talking to one of your colleagues. And I was asking her, she was telling me what she had thought of before she went into optometry. So as she was listing out the professions, all the healthcare professions, she said audiology, and it fit everything on my list. So, on my list was, I wanted to use technology. I wanted to be able to help people. I wanted to have flexibility of location to live. I wanted a profession with a good supply demand. I wanted something that people could relate to. Because when I would say to people, I'm an engineer, you just see the eyes glaze over. And there wasn't a lot of interest from the general public in engineering. Now, when I tell people I'm an audiologist, I mean, almost everybody has an ear story or ear concern. And so it's a lot more fun.
That's right. That's right. And I know, Ter, you sort of chose audiology because you felt, hey, it was an opportunity to really help people and make a difference. You've also have a really amazing engineering mind that you've brought to audiology, especially in your early career with cochlear implants. Can you just tell us a little bit about how you started that piece with, using some of your engineering background?
Well, after I left the oil industry, I had to do a bunch of prerequisites in psychology and linguistics. I did that at UVic, and I was a pretty focused student at that point in my life. And one of my professors introduced me to a company in Victoria that was started by a tech entrepreneur and a ear, nose, and throat surgeon. And so I did a summer placement with them. And then after I got my master's in audiology at UBC, I came back to work for them. And they were in the process of developing a cochlear implant as well as an implantable hearing aid. And so that was a really interesting experience for me because I got to use my engineering and my audiology. And yeah, it was. Unfortunately, it wasn't a unicorn. But it was a really good learning experience for me.
Yeah, and then I know you went into working in public health at the hospital in Nanaimo as well, and in Victoria. And I just wondered, what made you think, hey, I want to go into private practice? And now you sort of start wearing those other hats we chatted about, the business hat and the marketing hat and HR hat. Why on earth would you want to do that?
Yeah, it's a good question. At UBC at the time, we were really trained to be public health audiologists. We weren't trained in the business of audiology. And so, you know, my inclination coming out was to use those skills, and public health was a great spot to do it. I worked for about 5 or 6 years in a unionized type of public health environment, and I got to do everything that an audiologist could do in public health. I felt, and there wasn't any further upside for me from a growth perspective. So, my thoughts turned to private practice. I got my clinical doctorate through, it was at the time called the Pennsylvania College of Optometry, which is now Salus University. And, at that program prepares audiologists to start their own practices. And so I was ready to go. I had seen what you had done, and I thought, well, that there's some potential with that. And so at that point, I was consulting for different health authorities. So I would fly in to do clinics. And you were expanding your practice here in Cobble Hill, and you had said to me, Terence, if you've ever thought of starting your own private practice, now's the time. So it was a great it wasn't such a leap of faith. Whenever you give up a full-time salary, and at that time, actually, I have twin daughters, and they were just born. And so, whenever you need to pay a mortgage and you need to feed your family, it is a tough jump. So what really helped was, I had a space that I could rent from you, and I could do that as well as do some consulting to just pay the bills. So that's how I started.
We're going to take a quick break and hear from our sponsors. I'm thrilled to share an exciting new resource for professionals in the eye care industry, Eye Care Collective. Eye Care Collective is redefining collaboration and growth in our industry. Whether you're a clinic owner, optician, or eye care professional, this platform empowers you with the tools you need to streamline your operations and elevate your success. As a member, you'll enjoy the benefits of consolidated billing, access to competitive pre-negotiated discounts, and programs tailored to support the unique needs of your practice. If you're ready to amplify your impact in the eye care world, visit www.eyecarecollective.ca and find out how Eye Care Collective can support your journey to success. You probably do a good job of capturing contact lens sales after seeing a patient. But what happens when they use up their initial supply? Yes, your patients love you, but at refill time, they're probably just taking the path of least resistance to restock their lenses, going online or to the big box stores. These missed opportunities add up to tens of thousands of dollars leaking out of your business. That's where Auto comes in. Auto allows you to be that path of least resistance. Auto is the easiest way for eye care practices to stay engaged with patients and offer them a frictionless way to order their contact lenses and dry eye products from you, rather than from your competitors. Timely refill reminders and one-click reorders offer patients an unbeatable purchasing experience. And on the back end, Auto is integrated directly with your suppliers to allow for uber-efficient order management and fulfillment, saving valuable staff time. Over 600 clinics across Canada and the US are already using Auto to reclaim lost sales and simplify their workflow. Want to learn more? Check out their website at autooptics.io. That's OTTO optics.io. Sell more, do less with Auto. Hey, Tara.
Yeah.
What's the gold medal story? I know in your intake you said, hey, I've got this gold medal story I want to tell.
Well, I think the question was, what do you admire about optometrists? What do you like about optometrists? Are there any optometrists you kind of look up to? So, I thought that was a planted question because you're the optometrist that I know the best. And you know, there's several things that I think that you do really well, Trev, and managing the I don't know your technical skill as well as your management of your operations. So that's something that I really think that you do extremely well. And so I was, and this was some many years ago. I was just in one of your colleagues' office, and I noticed that on her wall she had a, University of Waterloo gold medal, and I knew that if you graduated at the top of your class, you get the gold medal, which I thought was pretty impressive. Then I went into another colleague's office, and she also had, I think it was University of Waterloo gold medal. So I went into your office, and there was nothing on the wall. There's no gold medal. So I was giving you a little ribbing. I said, Trev, where's your gold medal? And I think he said something to the effect of, they work with me, and that's my gold medal. And that stuck with me. And the longer I in practice, the more and more I realized that, having very smart, competent colleagues that want to work with you and that are hooked into your mission is extremely important. So kudos to you for having such a great team, great professional team.
Yeah, I mean, I think thanks for that. I think it's really interesting, right? If you can sort of set egos aside and you get a room or a team that's full of smart people, you know, none of none of us individually are as smart as all of us collectively. And I think that piece is really important. If you've got everybody moving in the right direction, in the same direction, in a synergistic way, then all that cumulative, energy and intelligence going in the right direction is certainly stronger than an individual trying to do that. I think that whole incubation opportunity was really fascinating. It was good for me too because I needed that space to sort of pay down some of my overhead because I was expanding as well, and I think you've taken that experience and sort of parlayed it into owning multiple clinics. Many of those are embedded in optometry clinics. Can you just speak a little bit more towards, about the business aspects or the synergistic aspects of optometry and audiology in sort of in a joint embedded type way?
Yeah, I think it's important for optometrists to understand that the penetration rate of audiology services, especially hearing instrumentation, is only 30%. So, of all the people that have significant hearing loss, only 30% of them do anything about it. Whereas in optometry, that percentage is much higher. It's, I believe, 90 plus percent. And so you have an overlapping patient base, which is walking past your door every day. And there are excellent synergies that can happen if you have an audiology clinic within or beside an optometry clinic.
Yeah, I at first, Tara, I thought, oh, this is going to be too nepotistic. Patients will view this as not the right fit, and then I soon learned what a great opportunity and a service for our patients to be able to access hearing care, and vision care in the same place in a trusted environment. And, I'm really proud of how well you take care of each and every one of your patients. And we're going to get into that in a little bit, some of your philosophies there. But you've taken that ability to make it synergistic. And from a cost savings perspective, we have one receptionist that can answer the phone calls for audiology and optometry and book those and take payments. And, from a workflow perspective, it can really work where some of the opticians can assist with dispensing, let's say, hearing instruments and dispensing glasses, of course, and just answering some questions and booking appointments. So there is a business case to make from that point of view. But also, I want to talk a little bit about the senses of hearing and vision, Terence. And I know you're uniquely positioned to kind of explain that. Can you just talk a little bit about hearing and vision diseases and how that collectively, cognitively can create an imbalance? Tell us about that.
Yeah, that's a pretty big question. But in a simplified way, when you have refractive error and you put on a pair of glasses, you see 20/20. But from a hearing perspective, most hearing loss is sensory neural. So it has to do with the cochlea. The cochlea is damaged. So in an optometry sense, it would be like your retina is damaged. And so it's not a simple matter of putting on hearing instruments and hearing quote unquote 20/20. The fundamental thing about hearing is that it is a process that happens very slowly over time. This is average hearing loss. So this is average age-related or noise-induced or genetic hearing loss. Typically happens very slowly over time. And an individual adapts by using their vision and by using their cognitive ability to fill in the blanks of the sounds that their ears are not giving them. And so we're talking about, the average time is about 7 years, but there are many people who do 10 years, 15 years of gradual hearing loss. And so the process of hearing instrument fitting is a different one than the process of putting on a pair of glasses. Not to simplify the putting on a pair of glasses, but the hearing instrument fitting process is very much a rehabilitative process. And it's a personalized process that happens, it's best done slowly over time.
Yeah, it's more rehabilitative, like physiotherapy to some degree in hearing. A lot of our listeners might not know that it takes, up to 7 years on average for someone with hearing loss to seek help. And I know we have some of our patients are presbyopic patients, which means you're sort of losing your reading vision. They're in denial for a long time. They're pushing things away. They're using their phone to light up their menu, or they're taking a picture and blowing it up so they can read it to avoid wearing reading glasses. And I think it's kind of similar with hearing instruments. That same sort of, okay, listen, this is an aging piece. How many people will suffer from hearing loss, Tara? What's the percentage there in your lifetime?
Well, 10% of the general population has significant hearing loss, but that percentage goes up the older one gets. By the time you get into your 90s, you've got hearing loss. I guarantee it. It's just a question of, whether people want to intervene. I'll tell you a little story. It's actually, I was blown away by it. After 25 years of practice, I had somebody who was 103 who came to see me. She had never worn hearing aids before, and she figured it was time to get started. She was at a home where all of her friends were wearing hearing aids, and she couldn't participate in the conversation. And I thought, no way, this is impossible in my head. But we gave it a shot, and she's a successful user. So, you know, that rehabilitative process, for sure, for many reasons, it's better done earlier than later, but it's not impossible. And you can do it right to the age of 103. In fact, hearing, it is said, we think that hearing is the last sense to go before death. And people can hear. They may not be able to open their eyes, they may not be able to speak, but they can hear. And our father had lung cancer went to his brain, and I saw him just before he passed away. Couldn't open his eyes, couldn't speak, but he could hear me.
Yeah, no, that's super fascinating. It struck home to me when we were talking about macular degeneration. Oh, that's the blinding disease at the center of your eye. You said, "Hey, Trev, all of your patients with significant vision loss, they really need to have their hearing tested." Can you explain why should they need their hearing tested when they're losing their vision?
Well, I would go and say that everybody over the age of 50 should have a baseline hearing evaluation, just point blank. And because what happens is hearing loss occurs slowly over time, you want to chart that. Now, of course, let me just back up and say that people, the theories around dementia and hearing loss, there's a couple of them. I'll share a couple with you. One theory is that, look, when you have hearing loss, you tend to retract yourself from social environments. The most difficult place to hear, just in general, is trying to hear people in background noise. So, like a party environment, a social gathering, the times when you need every scrap of your hearing, of course, that's when people with a little bit of hearing loss even have difficulty. So they retract themselves. And when you tract yourself socially, you got to think the risks of dementia go up. But there's another theory, it's called the limited cognitive resource theory, which says that, look, when you don't hear, you have to use your vision, you have to use your allocatable cognitive resource, and you have to fill in the blanks of what your ears don't give you. Hearing is a first order process. You have to hear something before you can understand it, before you can remember it, before you can process it and draw analogies and do all those higher order cognitive processing tasks that must be done when we have a conversation. So when it comes to, let's say, macular degeneration or blindness, of course, the less people see, the more they rely on their hearing. And of course, the less people hear, the more they rely on their vision. The two work together. Ideally, you want to keep both up. But if one is down, you definitely need to keep the other one up.
Yeah, you know, and having audiology under the roof of a vision care clinic, you know, together really lets you have some of those conversations. And, you know, I know my colleagues, Terence, we can tell there's hearing loss because, you know, we say, hey, better one or better two. And they're like, huh? You know, it's like they can't really hear you. And I'm literally screaming my recommendations. And so we can really tell there's hearing loss in our patients.
Yeah, I'll give your optometrist one important piece of advice. You don't speak necessarily louder to somebody with hearing loss. You speak a little bit slower. You maintain eye contact, you get a little bit closer. Those are the ways, because when we increase our voice, sometimes we change the emotional tone of what we're saying. So I think that's just a little trick for you to just have a better rapport with your patients.
That's great advice. I love that you're very patient as a practitioner with people with hearing loss, and I'm sure some of my colleagues get frustrated with someone with hearing loss because they don't understand, even though they cognitively could understand. So I think being empathetic with your patient that has hearing loss is great, but also being able to steer them towards a practitioner that could help them improve their hearing, I think is important too. So that's a neat little piece for us to be able to say, hey, if you're interested in investigating any hearing loss, we have that right here, inside our offices.
Mm-hmm. Absolutely.
Yeah, Tara, what about audiology and optometry? So we have at Couch and Eye Care, we have 5 clinics for me, and I have 3 of them are including residents hearing your audiology services inside of there. And what do you think the competitive advantage is for our independent practices together in a sort of a corporate dominated market? Like it's hard to replicate what we have.
It's hard to replicate, but I think it's replicable. And with all the right ingredients. But there's a significant competitive advantage for, I think, certainly for audiology and for optometry. When you can make things more convenient for a patient, that's in their best interest. If you can reduce the cost by providing some synergies, that's in their best interest. If they're familiar, so one of the things that just blew me away was one of my patients said, and this was a 60 something, totally socially adapted person. She said the hardest thing in my life was to walk through your front door. And by the way, this is in one of my clinics that's not integrated into your clinic. And I just got blown away. Well, why would it be so difficult? But the thing about it is, when you have hearing loss and it's happening slowly over time, you're in your 50s, you're in your 60s, the aging process is taking hold. Getting hearing instruments for people or investigating their hearing loss is kind of like admitting to themselves that they're getting older. The smoother we can make that process, the better it is for the patient population of your optometry clinic.
Yeah, 100%. I like to say things happen slowly, then suddenly, right? So if it's hearing loss or vision loss, it's generally happening slowly. And then all of a sudden, your ability to cope is not there anymore. And I have patients wake up and they're like, I could read yesterday and now I can't read today. not true. It's been happening over time. And I think that speaks to the fact of, getting a baseline test, getting periodic eye exams and hearing assessments so that you know where you're at, because you're not always the best judge of how well you're coping yourself.
Correct. And if hearing loss happens and indeed happens overnight, it can and does happen. There is a much different procedure that you go through in terms of timeliness is super important. So if you have a baseline and you know, hey, my hearing dropped like this overnight, well, we might be able to get it back with proper treatment.
Yeah. Yeah. I'm going to step back a little bit, Tara, and just talk a little bit about, originally from the beginning, for those of you who don't know, I encouraged you to go into private uh, healthcare because I thought you were really well suited to kind of be the creator of your own future, to control the aspects around patient care, because you're very, conscientious of making sure that each of your clients and patients get a really amazing one-on-one experience, customized solutions. And I think, what tell us a little bit about that, and what drove you to take that into creating more clinics and becoming this entrepreneur in hearing.
Oh wow. You know. Well, first of all, I would just say to you that my business philosophy is fairly simple. It is that I want the patient who enters my office to be happier when they leave my office. That's just how that's my key performance metric. And my practice just grew over time organically. And what happened was actually the first thing was that we thought, well, we can do this again in one of your other locations. So that's what we did. And then you said the third practice was you said to me, well, we're going to open up this new location, and it happens to be in a very small little town, and you said, well, we need audiology to make it work. So I said, all right, we can do that, and so that's the third clinic. The fourth clinic actually was something where you know I found an audiologist that was just amazing, and she lived in a different part of Vancouver Island, and I was like, wow, I don't want to lose this person. I want to create a clinic around her, and it was one of your colleagues that was opening a bigger office, and we just married those two, and that's how the fourth office came about. And the fifth office was again, you had said, "Hey, I'm creating a clinic in this area, and I need your help." And so I thought, well, you know, we've done it four times. Let's do it fifth. And so, it's just I I call myself a reluctant entrepreneur. I am not the business guy. I prefer to be in the clinic. Actually, I prefer to have a patient in front of me. That's my happy place. So it was just an organic it was an organic process. The fundamentals of the nature of the business of optometry and audiology, it's a natural way of operating a I think an optometry clinic as well as an audiology clinic. The tough part, actually, Trev, the tough part is when the audiology clinic grows to a sufficient degree that now it becomes a competition for space. And so that's something that fortunately for us, that we've been able to work out, but it can be one of the trickier parts of the process.
Yeah, in our first clinic that you were embedded in, you actually moved out because you grew so fast, and you have an amazing clinic. You're beside us, but with your own entity now. But it was attractive for us to have you there from a financial perspective, because we have a revenue sharing model. For those that don't know, we just share on the revenue side. So on the expense side, if you're growing your business, there is no expenses on the audiology side, but it certainly helps on the revenue side for optometry as they're trying to pay their overhead down over time. Because especially audiology can operate in such a small amount of square footage. What's the smallest clinic you have embedded in optometry in square feet?
Well, listen. I, 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 I'm not sure how you can operate in a very small space. So, in fact, we have one clinic that's less than 100 square feet. It's actually an 8 by 8 room, and it is a tight squeeze. I don't recommend it, but we do quite well out of that small space. And there are ways to share space as well. Although that's a dedicated audiology space, sometimes we'll use another room to do a certain procedure. And so, yeah, it can be done.
What advice would you give to optometrists, my colleagues that maybe want to bring in audiology services? How would they even get started with that?
Yeah, I think I my biggest piece of advice to the optometrists out there is to really find the clinician that that works well within your practice. And from our perspective, of course, I vet all of our clinicians, and there is a transference of reputation and service quality between the two professions from the perspective of, look, hey, if I go to, let's say, Shemanis Eye Care and Hearing, and I get my eyes tested and I was really happy with the experience, and they go to their hearing side and they don't get that same quality of experience, well, it's definitely not a win-win. So really, you need to find a clinician that is of sufficient expertise and mindset to what you have in your clinic.
Yeah, and that probably applies, even if you're bringing an optometrist in, right? Like the culture fit is just so important. You bring in an associate student that just graduated, a new grad, whatever it is, make sure the culture fits. I think that's important. But then, creating a business strategy. You and I have a financial breakdown as well. It's 20 to 22% in that range of where the revenue is shared with optometry. So there is an opportunity there to have a little bit of a revenue stream that helps to sort of offset some of the rent that you might be paying in your practice and improve your financial metrics. So it's been great to see, as hearing grows, our key performance indicators, our business metrics improve as well. So that's neat because you've got all your practices have continued on a sort of a growth trajectory, right?
Yeah, some are growing faster than others, of course. But yes, they're all growing, and so it's a blue sky kind of situation.
Yeah, no, even and you and I have been thinking more and more about how we integrate hearing and vision services. We haven't really been, quote unquote, aggressive with that. It's been a casual, like, yeah, we answer the phone. Thank you for calling, Couch and Eye Care and Resonance Hearing Clinic. So we're letting patients know that we have vision and hearing, and we're trying to sort of book more patients at both of the clinics that are inside that establishment. But are there any suggestions you have that you think maybe I can brainstorm right now? How could we do better?
There's always ways to do better, and I think really we're just in the first couple of innings of how good it can be. And if people understand how important early intervention is when it comes to hearing, especially if you have major vision loss, forgive me for using the wrong terms, but macular degeneration or blindness, where your vision is significantly compromised, oh, it is super important that your hearing is top notch. People just don't understand, that switching between senses and that reliance on the other sense and the importance for cognitive health. And we are all living, it seems to be living a lot longer than we used to be. And that last half of our lives, these things become extremely important. And so, yeah, there's lots of different ways. Whether it's a newsletter, whether it's having a program where all your macular degeneration program people get their hearing screened, whether it's technologies that cross the boundaries between your eyes and your ears. There is a lot of room for improvement.
Yeah, just give me an idea there, Tara. Brainstorming right now. We have a new age-related macular degeneration workup for high-risk patients, and I think exposing them to the opportunity to have a baseline hearing test would be a really great move there as well. So, on the AMD wellness side, that's a new area of optometry, but certainly could tie in audiology services there as well. So, thank you for that. You know what, Tara, I wanted to talk a little bit about the experience. I think, if you ever put on polarized sunglasses and went outside, you'd realize, wow, these polarized sunglasses are amazing. And so just having patients experience that, they really can see that the reduction of glare, the soothing nature, putting on high quality sunglasses is important and feels good. It would be cool to be able to be experiencing improvement of hearing in a way when you step into an optometry clinic. EssilorLuxottica have these Nuance glasses. Can you tell me a little bit about those?
Yeah, I mean, from what I know, what they are is, well, first of all, the biggest, as I said, the biggest difficulty that people have is hearing in lots of background noise. And so EssilorLuxottica has created some glasses which have microphones up here. And when you have microphones in an array, in a long line, you can get a super directional input beam. And with hearing instruments, we do the best we can, but we have these little small hearing instruments that are back here. When you have the microphones here, you have a significantly better directional input beam. And so they're playing off that concept. And then what they do is then they deliver the sound through a speaker that's somewhere around here and shooting the sound into the ear. So that's as far as I know about how they work. I believe they're undergoing FDA approval in the United States. Let me just back up and say that in the United States, there's a new class of hearing instrumentation called an OTC hearing aid. So you don't need to go and see a professional. You can just order one off of Best Buy or what have you. But what we've seen is, of course, because the nature of hearing loss is rehabilitative, it hasn't caught on and hasn't done very well. But the real attraction of Essilor's glasses, I believe, especially in an optometry office, is that exactly like that you said, is that this is something that you can put on and get a little bit of a wow effect from a hearing perspective that I believe will be, and forgive me for saying this if EssilorLuxottica is out there, but pale in comparison to the kind of performance you can get from a prescriptive hearing aid fit in a rehabilitative assessment. But it does whet the appetite in terms of, hey, maybe I do have a hearing loss. Oh, wow, maybe these are helping me. And it opens the door, I believe, will open the door to audiology services within optometry clinics.
Yeah, I know I'm aging myself, but I'm thinking of Steve Austin, the $6 million man, when he could just kind of point at somebody and eavesdrop over there as to the Bionic Man, what he can do. But I mean, it's pretty amazing. Like I did try those at Vision Expo, the Nuance glasses, and it's pretty cool. Like it does enhance your hearing ability, and it makes you wonder, hey, what could really fancy hearing instruments do to just improve even a pseudo normal hearing piece? Can you cut certain frequencies out? Would that be more soothing to you to cut out a certain frequency? Do you see a world in the future where there's mild hearing loss, where people get these assistive devices, whether it's glasses or whether it's actually hearing instruments, because it's so much technology that allows you to sort of improve your performance overall?
Oh, 100%. 100%. Absolutely. First of all, people with mild hearing losses generally don't either know or admit that they have any kind of hearing loss. And they are struggling to some degree, not necessarily struggling. They don't even know that they are using this cognitive resource to help with their hearing. And so when you put on a pair of glasses like that, let's say, for example, and you find, wow, it's so much easier to hear in this environment, you release this cognitive resource. So it will create a little bit of a wow effect from a cognitive perspective, I believe. Now, that's the current mode. Another thing that we're seeing increasingly in the last 5 to 10 years, let's say, is that hearing instrumentation, traditional hearing instrumentation, is Bluetooth compatible. So it's like wearing a wireless earbud in your ear, and so tapping, you can just tap your ear and ask Siri a question, ask your AI bot a question. This is outside of the zone of audiology, but having seen what AI can do, I believe AI will become an increasing part of a necessary, actually, part of how we navigate certain parts of our world. And the ear is a great spot to have that incorporated. And I'm not sure about glasses. I know that Google had their glasses, their internet glasses, a while back. I'm not sure how much that's caught on, but hearing instrumentation is a discrete way of being connected to the internet or AI capabilities.
Yeah, 100%. We have these Meta Ray-Ban glasses as well, which are AI assisted. It's amazing, even for someone with lower vision, that AI assistant can augment what the patient is seeing, what the customer is seeing with AI. Take a picture of it, describe what you're seeing, and then give you more layered information on that. So it's quite fascinating. I think there's a whole area of growth in wearables, whether it's in the ear or on your face with glasses or both, to be able to sort of help us navigate through the world. So it's pretty exciting times for us. We have to understand a little bit of the technology that's coming down the pipe. So I think that's going to be an area that we're really going to see go forward. And it's kind of cool for have audiology and optometry under the same roof to be able to take advantage of those technologies. Yeah. So, Tara, I just wanted to, talk about a little bit about your strategies of building strong and trusting relationships with patients, especially those that might be resistant to care. I really admire your ability to kind of play the long game, as you suggested to me. Can you just explain that to our listeners?
Our mandate is to help patients, and so the motto I use is patience for life. And people are on a hearing journey. We're all on a sort of a hearing journey. Whether your hearing's normal, whether you have the beginnings of hearing loss, or whether you have, significant hearing loss and are on your fourth set of hearing instruments. Our philosophy is we are not here to quote unquote sell hearing instruments. Unfortunately, most of the industry has what's called help rates or close rates or capture rates. And I just don't subscribe to that philosophy. I want to treat people the way that I would want to be treated going into an office, which is I want people to be my partner in my healthcare and to give me their advice and to allow me to make that decision at the pace that I'm ready to make that decision. And that's how we practice. And it's just one of the things I'm proud of is that when people say to me, you have such a great reputation," and that, and I'm assuming they're not confusing me for you, by the way. But that to me means everything to me. And by the way, the financial performance of my practice is excellent, but that doesn't mean it nearly as much to me as the fact that each one of my patients is really happy. I had another fellow. This happens, thankfully, a few times a year, where somebody will say, I talk to everybody with hearing instruments, and not everybody's happy, but all of the people that come to you are happy. And for me, that's my bottom line. That's success. Another metric of success, by the way, is the number of hours per day a patient wears their hearing instrument. Historically, people would get hearing instruments, and they would eventually end up in a drawer, and they wouldn't wear them. But my goal is to make things, first of all, super effective, comfortable, aesthetically pleasing. So usually that means difficult to see. I want to make sure that they are aware of how to use it, with their cell phones, how to adjust it, etc. And if I can achieve all that, well, why wouldn't you be wearing it most of the day? One of the things that people don't understand as well is that there may be nobody around. You may be sitting at your house and it's quote unquote dead quiet. There's always sound. There is always sound, and that sound is being processed by the brain. Okay? And when it's processed by the brain, that's a form of exercise for the auditory system, and that is super important for good hearing health and good cognitive health.
Yeah, thanks for that. Tara, does that your philosophy of patient care give, that your independence, and this can include optometry, an advantage over corporate where they're driven by capture rates and driven by a certain, production ability to, profitability piece? What are your thoughts?
Oh, I think so. I absolutely think so because you know patients tell me that when they walk into a corporate office, it's a much different feeling than walking into my office. They feel warm. They feel at home. I you know I can't really say that objectively. Like what is it like? I don't really walk into corporate offices myself, but I think it's a distinct advantage when you consider when your mandate is patients for life. You have a different approach than a close rate. It's just a different mentality, and I think patients feel that. And I think in the end, and we see that now. We've seen that for the last number of years. People just that you don't need to market, you know, and the number one. I was blown away at industry costs for marketing, at how expensive, how much money the corporates put into marketing. And when your practice has a great reputation, and you guys know this in optometry, the word of mouth is carries you. And we of course market. It's a strategic, obviously necessary thing to do, but we spend way less than the corporates do.
Yeah, the acquisition cost for a hearing patient can be very high, as we've talked about before. But when you can do it organically, like you do it with amazing services and word of mouth referrals, I think that's very, very powerful. And I know as independent practitioners in the fields of audiology and optometry, we're able to kind of build the kind of practice and the kind of feeling that we want and the kind of care to patients that is really hard to do at a corporate setting where there is not the same skin in the game. So I know you sometimes are working long hours. Yesterday you were driving something to your practice to drop off to make sure the patient had it. So I think that extra care that you're able to deliver, because this is your baby, is really a differentiating factor for independent practitioners.
Yeah, and when it comes to the optometry audiology collaboration, we found success in making sure that that audiologist is a owner in the business, not in the optometry business, but in the hearing business. And so, yeah, it's super important.
Yeah, Terry, have you noticed a trend towards, like, in glasses? I have some kids that they start crying because they don't, I haven't prescribed glasses to them. Whereas when I started practice, 30 years ago, they'd cry when I told them they needed glasses. Now kids want glasses because it's cool, kind of like braces. I don't know, those orthodontists have really figured out how braces became cool. But how do we make hearing instruments cool?
Well, that's a good question. Well, I'll tell you, my patients tell me that when they get together, they talk about their eyes, their teeth, and definitely their ears, their hearing aids. So the, the senior set is talking about hearing aids and talking about who they went to and what kind they have, and so I don't know if we can make hearing cool to or we need to make it cool to the tweens, but we definitely need to make it cool to the senior set. And the way that you do that is word of mouth, I believe, and establishing relationships and great technology, effective technology. And when your senior friend is telling jokes and talking around the table and enjoying their dinner dinner party, that is cool to that particular set. And if you can make your patient that person, you will win.
Yeah. Or alternatively, we could go to a bridge tournament. Terrence and I play bridge, and we just eavesdrop on the conversations and pass out our cards. So that's another little strategy. Um,
Not a bad idea, Trev. Let's do it.
Dude, I think we totally should do it. Totally. I'm going to bring my cards. If we ever play a bridge tournament, I'm going to bring my business cards for sure. Terry, I wanted to chat a little bit about getting confused um, for each other or mistaken identity,
Oh yeah.
which is quite interesting. I always tell patients sometimes. I mean, I've had conversations with patients that I thought were vision care patients, and I'm 10 minutes in, and then they're like, "Okay, I'm going to stop by and get my hearing instrument adjusted next week," and then I go to you and I say, "Well, oops, I just talked to a lady." Thinks I was you, and I just couldn't break it to her. I'm not the audiologist, so I know we've got a lot of listeners for our podcast, and they're not seeing the video. But Terrence, my brother, and I sound very similar, and we work, in close proximity. So some people mistake me for the audiologist and Terrence for the optometrist, and we have a dentist beside us who also, has a certain resemblance to us, and so it's a complete confusion. I sometimes, when I tell the story, I say, if you're totally confused, then go see our sister, who's a psychologist.
Heaven forbid.
Yeah, exactly. I mean, I know Tara, even, when we talk to our mother, who's passed away now, but when we talk to mom, sometimes she wouldn't, she would mistake us with our voices. Do you have any stories for me about, mistaken identity with myself?
Well, the at the beginning of when I started practice. I mean, Trevor, you've been practicing for a number of years before I started in the Cowichan Valley, and so I would get mistaken quite a bit, and for you, and thankfully, Trev, you've got a good reputation because that really, I think, did nothing but good. Share the reputation for me, so that was really good. Perhaps the funniest thing happened is, as I say, we have this dentist that's a couple doors down from us, and he is Lebanese, and he's about my height, and he has a shaved head like I do, and so we my spouse actually thinks that I look more similar to him than I do to you. And so, I was walking around. There's a trail around my house, and I was walking, and there was a guy maybe about 20 or 30 meters away, and he shouts at me. He says, "Hey, you're my dentist." And, and so I was just about to explain to him, because I always have to explain to people what exactly is going on. And then he stops me. He puts his hand up like this, and he stops me, and he points to his eyes, and he goes, "No, you're my optometrist." So yes, there are people that unfortunately think there's one dude that's like running back and forth between the clinics, seeing teeth, eyes, and ears. So
I mean, it's genius from a marketing perspective, right? Because you're out in the community, or I'm out in the community. People are thinking either eyes or hearing or both, which is not a bad thing. So I think that we're kind of, doubling up our ability to get the messaging out. So I actually am really appreciative from a
well,
marketing
I
aspect.
think I think you said to me earlier on in your career, you said, Terrence, you're a walking billboard for me. Don't do anything embarrassing.
Yeah, and that's interesting. I especially when we chat with students that are coming into the profession of optometry, I let them know, hey, you're the best advertisement for your business as you go forward. You as a person, that sort of one-on-one marketing is how people grow their patient following, and tell those people tell about others about how great that person is, and as a practitioner and such. So it's important to I think, take that position in your community wherever you end up in optometry or audiology. So we're lucky to be able to do that for us, Ter. Okay, so we're going to do a little segment that we used to call Better One or Better Two, but in this case, we're going to call it Better Trevor or Better Terence. Okay, so question number one. Growing up, who was more likely to get their way, Terence or Trevor?
Trevor,
Why's that?
because he was older. He used his quote unquote size to beat up on me.
It's amazing. I wish we could go back then and I could be bigger than you. You know that those are the days when you can like sort of manhandle your brother until he catches up and fights back. So yeah, sorry, I apologize for everything I did when you were a kid. Okay, better Trevor or Terence? Who got into trouble the most?
Trevor, because I would kind of I remember when we were kids, I would kind of fake being hurt, and then Trevor would get in trouble. So definitely Trevor.
That would drive me absolutely crazy. I remember our dad picking you up, and you'd give me the nana nana boo boo sign. You know, after you'd stop crying just for a second, yeah, just to mock me, and then you'd go back to crying to get all the sympathy while I got in trouble. I've hidden that from my past, but you know what? It's coming back to the surface now. I need revenge, man. That's okay. Who was the favorite son?
Terrence.
For sure. The youngest is the baby. I mean, come on. Everybody loves Terrence. Who got the better grades in school? Trevor or Terrence?
Terrence.
Yeah, you know, except that 1 year in, I think you were in grade 9 and I was in grade 10. And you got I got a bunch of awards and you got the music award. And instead of calling you up because I had won some other awards, they accidentally called me up and presented me with a trophy that said Terence Miranda on it. Do you remember that?
I do remember that, and maybe that's why I doubled down on my efforts after grade 9.
Yeah, you know, and I mean, for our listeners, Terrence is super, super smart. It's really great to have a brother that's really smart. And still, I tell my kids, you know, when they're all in university, you know, ask Uncle Terrence because I don't know, I can't help you with engineering questions like Terrence still could. Who has the better sense of humor, Trevor or Terrence?
Yeah, Trevor.
I'm a little more crazy than you, I think, but you have a really great way of looking at the world. So really appreciate your sense of humor too. You also chuckle at my jokes, so that makes me feel good. Who's more competitive? This is a good question. Trevor or Terrence?
That's a tough one. The reality of it is that we're both super competitive, especially with each other. Um, that's interesting. It depends on what it is. Uh, but that's a tough one because if we're on a tennis court, I want to mop you up with that court, brother. Absolutely. But if we are, let's say, in business, I'm maybe perhaps less competitive than you, less driven than you are.
I mean, you know, it's on a relative scale, hey, Tara. I mean, we are some of the most competitive people I've ever met, you know, and so some of our listeners won't understand when that's a hard question to answer because we're both uber competitive. And I think one of the cool things too is like being a competitive person or in business or in sports or whatever. If you're kind of constantly trying to improve and be better, that's part of being competitive. So it can drive you to excellence as well as noticed in your business and your athletic endeavors. So good for you.
I mean, Trev, we were brought up in a competitive type of household, so it's really kind of not just it's nature and nurture as well in terms of our competitiveness, and I think we both though have this we can compete to a higher level, not necessary to beat the other person, but to improve ourselves. So um, That's
Yeah, no, 100%. I mean, back in the day, it was like, yeah, you win or you lost. There wasn't this participation medals like we see, today more. And you wonder, what the impact is of that. It's great that everybody gets to participate, but you and I wanted to win. We wanted the gold medal.
right.
Thank you, Terence, for playing better Trevor or better Terence. Do you have any questions for me, Ter, right now?
How's the podcast going, Trev? Do you like doing a podcast?
You know what? I am loving doing Optometry Unleashed in the podcast. It's really fascinating. I had somebody that recently graduated from the University of Toronto. She's a tennis player and in biotech, and reached out to me and wanted to connect and chat about you know AI and other things, and I thought it was really cool. And she heard about me by listening to our podcast, so it's kind of interesting the connections you make there. And for me, getting a deep dive into our guests and getting the stories and the background, I think is really exciting. So I just enjoy the chat, and I'm glad we have a growing listenership. So. Ter, you mentioned philosophies on purchasing, buying the least expensive and getting value and getting the best, very best money can buy. And I wanted to chat a little bit about this philosophy. My philosophy is, it's incumbent on each practitioner or each business to not hide what the premium solution is from your patient or client, letting them decide what's best for them. What are your philosophies?
Well, absolutely. I think what I feel is my job, and what our job is as clinicians, is to tell people, all of the options available to them. And so, the way I explain it to people is that, if you haven't heard for a long period of time, getting into hearing instruments is kind of like, one analogy is kind of like getting a car. Going from walking to driving is a huge change. Even if it's a very basic, let's call it a Yaris or something like that, basic new car, your level of improvement in your life is going to be significant. But if you look on the road, you'll see the Yaris, you'll see the Hondas, you'll see the Acuras, and you'll see the Teslas, because I know Trevor drives a very nice Tesla. But you'll see the range of cars out there, and why is it that people drive a Tesla? And why is it that people drive a Toyota? It. So I generally draw people a curve, and this is the engineer coming out in me, where it's on the vertical axis is benefit, and on the horizontal axis is cost. And the curve, in my opinion, tends to go like this, and then it tends to kind of asymptote a little bit. And the rate of benefit as you go higher up becomes increasingly less. And so I tell people, first of all, by stepping into hearing instruments, you're going to get a significant benefit. But if you want the best, well, that's also very easy. But if you want the best cost benefit ratio, it tends to be on the inflection point of the curve. So I hope that you're all optometrists, by the way, are, I have to say, super smart, super personal. Love them, so they'll know what the inflection point is. But that's sort of the best cost benefit ratio. Now, having said that, a high percentage of my patients go for the very best, and why is that? There's multiple reasons for that. But one of the things that I relate to them is that we're not driving cars, by the way. This is, when it comes to a basic human sense, it affects your entire life. And I give them the example of the NeuroLens for you, because I kind of a little bit embarrassed, because it didn't really hit home to me until recently, the effect on my life of, let's call it, a small improvement. Was wearing Tom Fords before these, and I was quite happy with my glasses. And Trevor came to see me and said, "Hey, Terence, you need to try these new lenses." And I said, "Trevor, I can see just fine. I don't need to try the new lenses." He said, "You got to try these new lenses." So I said, and Trev can be very persistent, by the way, as you may know. And so all right, I'll try them. My first impression was being underwhelmed. I was like, oh, okay, maybe this is a little bit better. It's like 5% better. But that was my first impression. Then I wore it throughout the day, and I noticed that 5% of everything that I saw was better. or everything I saw was 5% better. And I realized at the end of a couple of days that it was a significant improvement in my life. And if somebody can improve at this stage in my life, if somebody can improve my life by 5% for a grand or two, I'm in. I'm totally, totally in. Because, you know, the my clientele is perhaps a little bit different than optometry's clientele, in that my clientele tends to be in the last half of their life. And when we're in that, and I'll include myself, I'm in the last half of my life. And when you're in the last half of your life, you realize that time is super important. You want to squeeze as much enjoyment from your life as possible. And if somebody can increase that by 5%, that is amazing. Now, we do that much more with on a hearing side. It depends on the degree of loss and the length of time that somebody has got hearing loss. But generally, people who can afford it, it comes to a basic sense, they should and do want the very best that they can afford. But having said that, I present that entire picture to people and they decide. And I tell people, I'm going to work as hard. It doesn't matter what you choose. I'm going to work as hard as I possibly can to get the maximum benefit from whatever you choose. And people like that. And I would like that if I was coming into somebody's office. It's no pressure whatsoever. It's the full spectrum of options, and we make sure that we're cost competitive with the I'm not sure if I can say it on here, but that the big box stores, and that there's a ton of clinics out there that their high end is significantly higher than us. So we do a great job on making sure that what we offer is in a reasonable and as much as possible affordable price range for patients, and let them decide what they want to do with their ears and their life.
Yeah, and you could thanks for that. You can substitute their eyes in their life exactly there. I think sometimes optometrists get a little too paternalistic in deciding what the solution is, rather than exposing to them the premium potential solution as well that may give them 5 or 10% better outcomes. Let the patient decide, and I think it's they can pick whichever one they feel most comfortable and is within their budget and what they want to invest in. But we shouldn't hide the optimal solution because we're concerned about their budgets. They will let us know. So I appreciate that you give the full spectrum, and I encourage our optometry listeners to do that as well, and empower your patient to make the decision for them based on the education that you provided. So good for you. That is definitely a differentiating factor of your success, Terrence. So thanks for sharing that. Tara, I know there's new technology coming into optometry space all the time, whether it's neural lens or treating macular degeneration, or it's these hearing glasses. How do we incorporate all of these technologies without really disrupting patient flow? And are you finding that in hearing, where you can have the opportunity to bring in new technology or new equipment?
Hmm. That's interesting. Well, we certainly have new technology all the time in audiology, and that tends to be not as much on the diagnostic side as on the rehabilitative side. So, specifically, hearing instrumentation. Um, of course, on the diagnostic side as well. But you know, in our practice, in our business, it doesn't really disrupt patient flow. It is, it's more about how do we relate that technology to the patient? How does the patient appreciate the technology, understand it, such that they, um, you know, are okay with spending money for it? And you know, relating that technology to a in layman's terms, and especially in today's uh, you know accelerating technological environment, is part of the art and part of what we need to do as clinicians.
Yeah, sort of be their guide, right? A trusted guide. I think that
Absolutely.
that piece of trust that you've established with your hearing clients, and that we try to establish with each of our vision care clients is really really important, so that that is what you're growing, that lifetime relationship, those patients for life. So I think good for you. So Terence, as we yeah, go ahead.
But I just want to say there's several differences between optometry and audiology, and one of them is that in audiology we can actually do a trial of hearing instrumentation with a patient to what I'm of the firm belief that the proof is in the pudding. And so when a patient tries a new technology, they can experience for themselves what the difference is. So we have a 2 month trial period. Patient can try it. We work with them. And if they decide, well, no, it's not enough of a difference, we send it back to the manufacturer. The manufacturer refunds us. Of course, we're out our time, but we wouldn't embark on that process unless we felt that there was a significant enough chance that there would be a significant improvement for that patient. I'm not, I'm not sure if you can do that in optometry or not.
Well, you absolutely can do it in optometry. And I think that is one of the tenets of independent optometry differentiating from corporate. We can have a guarantee. We can have a satisfaction guarantee. And so we brought in new, migraine reducing spectacle lenses recently. And it's guaranteed. Like if you don't think this it mitigates your migraine symptoms or reduces the frequency of migraines, then we're going to refund your money 100%. So I think allowing us to have these guarantees and the companies backing us with these guarantees allows us to incorporate new technologies faster than some of the other players there. And then it's another differentiating reason. You get your eyes checked because you can't see, but do you get your eyes checked because you have migraines? We can help with that too. So it's really fascinating from that point of view. So thanks for sharing that, Terence. I wanted to, in closing, just wanted to sort of, you know, and reflecting upon your journey in healthcare and in audiology. What's one key takeaway lesson you want to leave our listeners with?
Oh wow. Um, hmm. I would say to you, think long term. Think long term, and you know, eyes aren't going away, ears aren't going away. You're going to be in practice for the long term, and so make your decisions uh, like you were playing an infinite game. That's that's what I would advise your independent clinicians.
Yeah, you know what? I'm always impressed that you're not caught up in that short term revenue noise that sometimes you tell me, hey, revenues can be choppy in audiology because a hearing instrument could be thousands of dollars, and you could have a bunch of days where you make no sales in your business, but that has never deterred you because you always realize in the long run, if I could have my patient realize that I'm their partner in their hearing, and the corollary, we're their partner in their vision, that they will always choose us when it's time to purchase.
Yeah, and I would also say another piece of advice I would give is, seek partnerships. And, in my life, and I'm sure all of your optometrists know this, but, and as you talked about at the beginning, it's very difficult to do something by yourself. So, good relationships, good partnerships with everybody around you will bode well for your future.
Yeah, absolutely. And Terence, it's super proud of all that you've accomplished. I'm really excited to see your business growing, and you doing amazing things. And a lot of vision clients that come over to me, they're more excited to see you. You spend a little bit more time with them, and so we keep jabbing each other with insults passed via our patients to the other one. So back to the sibling rivalry. But quite honestly and truthfully, it's amazing what you've done in audiology. Thank you for helping grow my business with your audiology services, and really appreciate you joining us here on Optometry Unleashed to sort of share your perspectives, business and personally, on audiology and optometry synergies. So thanks for joining us.
Well, thanks for having me, Trev, and of course, thanks for being the big brother and leading the way. And I would say to your optometry colleagues that, you know, I wish you luck, and I hope that you can help to increase the awareness of the importance of hearing and good hearing in the aging process.
Yeah, and especially for those folks that have lost some vision, don't forget that enhancing your hearing, it could be a really game changer in terms of lifelong enjoyment. So, thank you for sharing those features, and thank you for all our listeners on Optometry Unleashed. This is Trevor Miranda. We look forward to seeing you next time on Optometry Unleashed.